Trial of Amitriptine, Topiramate, and Placebo for Pediatric Migraine. Definition: migraine is a common disorder in children. Estimates indicate that 3.5 or 5% of all children will experience recurring headache consistent with migraine. Management consists of identifying triggering factors, providing pain relief, and considering prophylaxis.
More than 6 million children and adolescents in the United States have migraine headaches. Current clinical practice guidelines for pediatric migraine are based on expert consensus, given the lack of evidence for specific therapy. The CHAMP trial aimed to assess the benefits and harms of two of the most commonly used medications for the prevention of migraine in pediatric patients. This Phase 3 multi-center double-blind placebo-controlled trial was conducted in the United States and enrolled children and adolescents 8 to 17 years old with a diagnosis of migraine causing at least mild disability and a baseline headache frequency of at least 4 days per month. 361 patients were randomized in a 2:1 ratio to oral amitriptyline, Topiramate, or placebo for 24 weeks. The trial was stopped early for futility. For the 328 patients with data to analyze, the primary outcome, a relative reduction of 50% or more in the number of headache days, was no different in the three groups, occurring in 52% of those in the amitriptyline group, 55% of those in the topiramate group, and 61% of those in the placebo group.
Application in medicine. We conducted a randomized double-blind placebo-controlled trial of amitriptyline 1 mg per kilogram per day and placebo in children and adolescents 8 to 17 years of age with migraine. Patients were randomly assigned in a 2-to-1 ratio to receive one of the medication or placebo. The primary outcomes was a relative reduction of 50% or more in the number of headache days in the comparison of the 28 days baseline period with the last 28 days of 24-week trial. Secondary outcomes were headache-related disability, headache days, number of trial completers, and serious adverse events that emerged during treatment.
Amitriptine is a prescription medication used to treat the symptoms of depression. Amitriptyline belongs to a group of drugs called tricyclic antidepressants, which work by adjusting the levels of natural chemicals in the brain. This medication comes in a tablet form and may be taken once or multiple times a day, depending on your doctor's instructions. Common side effects of amitriptyline include nausea, vomiting, and weakness. Amitriptyline can also cause drowsiness and dizziness.
So one of the other questions I get about leucemia is often, well, what's this other ingredient? I know phentermine is, but tell me what topiramate is. Topiramate's a medication more commonly used in migraine prevention. Sometimes used in epilepsy as well. Originally, it was combined with phentermine because one of the side effects of topiramate is weight loss. People would take it and they would lose weight, and so putting them together as one, it can help facilitate weight loss.
Pros and cons. There were no significant between group difference in the primary outcome, which occurred in 52% of the patients in the amitriptine group, 55% of the dose in the topiramate group, and 61% of those in the placebo groups. There were also no significance between group difference in age-related disability age days, or the percentage of patients who complete the 24 weeks treatment period. Patients who received amitriptine or topiramate had higher rates of severe adverse events than those receiving placebo, including fatigue, 30% and 40%, and dry mouth, 25% and 12% in the amitriptine group, and paresthesia, 31% and 8%, and weight loss, 8% and 0% in the topiramate group. Their patients in the amitriptine group had serious adverse events of the altered mood, and one patient in the topiramate group has a suicide attempt. Conclusion. There were no significant difference in reduction in headache frequency. Headache-related disability in childhood and adolescent migraine with amitriptine, topiramate, or placebo over a period of 24 weeks. The active drugs were associated with higher rates of adverse events.